Assalamu alaikum. Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Now I would like to discuss about the neurotic disorder. Neurotic or neurodegenerative disorder starts with this anxiety disorder. In anxiety disorder, inappropriate experience of what? Inappropriate experience of fear or worry and their physical manifestations and their minimal manifestation incongruent with the magnitude of the stressor. Very tough word. Symptoms not uh, symptoms are not attributable to another medical condition like psychiatric disorder like hyperthyroidism. There is no underlying medical condition or underlying substance use. It includes panic, phobic, generalized anxiety, and selective mutism. For anxiety disorder, for GAD, generalized anxiety disorder, in children and adolescents, there is excessive, uncontrollable worry, excessive, uncontrollable worry of multiple issues for more than 6 months, worry, excessive, uncontrollable worry on multiple issue for more than 6 months with one or more than one of the following: restlessness and feeling on the edge, fatigue, difficulty concentrating, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Restlessness, fatigue, difficulty concentrating, difficulty concentrating, irritability, muscle tension, and sleep disturbance. There may be some sort of physical symptoms like stomach ache and headache, and some sort of perfectionism is going through. You should give CVT and SSRI. SSRI is the drug of choice. SSRI or SNRI is the drug of choice. SSRI are fluoxetine, paroxetine, fluvoxamine, sertraline, citalopram, escitalopram, and SNRI is venlafaxine, milnacipran. These are the drugs used for GAD in adolescent and children. So excessive, uncontrollable worry on multiple issue for more than 6 months with one of the following feature: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Now panic disorder or panic. Okay, for panic disorder there is recurrent. In panic disorder there is recurrent panic involve intense fear, intense fear intense fear or discomfort with or without a known trigger. Recurrent in Recurrent panic attack involving intense fear or discomfort with or without uh, a known trigger. The mnemonic is panic. PANIC. The mnemonic is panic. What does the panic means? Palpitation, paresthesia, abdominal distress, personalization and derealization. Personalization, which is depersonalization, derealization, abdominal distress, or nausea, intense fear of dying, intense fear of losing control, uh, intense fear of losing control, that means light headaches, chest pain, chill, choking, Sweating, shaking, shortness of breath. Sweating, shaking, and shortness of breath. Sweating, shaking, and shortness of breath. These are the things happens in panic disorder. So strong genetic component, increased risk of suicide. Increased risk of suicide. Diagnosis require attacks followed by more than 1 month with one of the following. Attack followed. Diagnosis requires attack followed by more than 1 month with one of the following, like persistent concern of additional attack, worrying about consequence of the attack, and behavioral change related to attack. These attacks typically peak in 10 minutes and four of the following or and four of the following and four of the following. So these attack persistent concept of the additional attack, worry about the consequence of the attack, and behavioral change related to attack. Symptoms are systemic manifestation of fear. CBT, SSRI, venlafaxine are the first line. Benzodiazepine are often used in acute setting. In acute panic, benzos can be used. In acute panic, benzos can be used. This is high yield. In acute panic, benzos can be used. So in panic disorder, recurrent and unexpected panic attack, recurrent and unexpected panic attack with four of the following, like palpitation, paresthesia, personalization, derealization, abdominal discomfort, nausea, uh, intense fear of dying, intense fear of choking, and lightheadedness, and there may be chest pain, there may be chills, chest pain, choking, and sweating, shaking, shortness of breath. The all features present in panic disorder. So recurrent unexpected panic, four of the following for more than a month. Four of the following for more than a month. This is known as panic disorder. First line is SSRI, cognitive behavioral therapy, and in acute distress, benzodiazepine should be used. In panic disorder, benzos can be used. So I have already finished about panic. Then in acute attack, benzos. In main treatment is CBT, SSRI, venlafaxine are the first line. Now, phobic disorder. In phobic disorder, there is severe and persistent phobia for more than 6 months. For more than 6 months, 6 months of fear or anxiety due to presence of anticipation of a specific object or situation. Person often recognize fear is excessive and CBT with exposure therapy. This is high L. CBT with exposure therapy should be given in phobic disorder. In phobia, there is social anxiety disorder, there is agoraphobia, there may be specific phobia. In social anxiety disorder, like social phobia, in social phobia, what happens in social phobia? There is marked anxiety about one or more than one social situation, marked anxiety about one or more than one social situation for more than 6 months. Social, more than one social situation for more than 6 months. Fear of scrutiny by the others, humiliation and embarrassment, social situation avoided and endured with intense distress and marked impairment, social, academic, occupational. Subtype specifier is performance only disorder. There is SSRI, SNRI, CBT, beta blocker, and benzodiazepine for performance only subtype. Social anxiety disorder or social phobia. So exaggerated fear of embarrassment in social situation like public speaking or using public restrooms. Treatment is CBT, SSRI, SNRI for performance type anxiety restricted to the public speaking. Use beta blocker or benzodiazepine. Use beta blocker or benzodiazepine as needed. Use beta blocker or benzodiazepine as needed. In agoraphobia, agora means marketplace. In agoraphobia, irrational fear, uh, anxiety, and avoidance while facing or anticipating two specific situations, more than two specific situations like public transport, like open or closed space, like lines and crowds, being outside at home or alone. Associated with panic disorder, CBT and SSRI should be given. So in phobia, more than 6 months, CBT with exposure therapy, this word is high L. There is social phobia or social anxiety disorder, more than one social situation for more than 6 months, more than one social situation, one or more than one social mm, situation for more than 6 months. It has subtype specifier like performance anxiety, and another one is agoraphobia. Agora means marketplace. If there is a phobia in two situations, two specific situations, public transport, open or closed spaces, lines or crowds, being outside home or alone, then it is considered as agoraphobia. Agoraphobia are best treated with cognitive behavioral approach. Then I have already discussed the generalized anxiety disorder. In generalized anxiety disorder, excessive worry, excessive anxiety or worry in different aspects of the daily life, work, school for more than 6 months. Excessive worry for more than 6 months. In here, you have to remember the crimes. Mm, three of the following in adults, one or more than one for kids, one or more than one for kids. Concentration difficulty, concentration difficulty, restlessness, irritability, muscle tension, energy low, and sleep disturbance. Anxiety for crimes associated with three of the following for adults and one or more than one for children for more than 6 months. Three or more than three crimes: concentration lost, concentration difficulty, restlessness, irritability, muscle tension, energy loss, and sleep disturbance. CBT, SSRI, SNRI are the first line. Buspirone, TCA, benzodiazepines are the second lines. Then OCD, obsession and compulsion. In OCD, there are two terms, that one is obsession, another one is compulsion. Obsession means intrusive, recurrent intrusive thought. OCD. In OCD, the must in obsession in obsession, there is recurrent intrusive thoughts or sensation that can be that can cause severe distress or compulsions that can cause severe distress or compulsions. um, Compulsion, repetitive, often time consuming attacks that may relieve distress, associated with tics disorder, pour insight into belief or action linked to worse outcomes. CBT, SSRI are the drugs. Clomipramine and venlafaxine are the second line. Clomipramine and the venlafaxine are the second line drugs. Obsessive compulsive disorder is a unique disorder. It has obsession and compulsion. We have already told that. But what are the common obsession? Common obsession one is contamination. And contamination means fear of dirt, germ, concern, or disgust with bodily secretion and waste, such as stool or urine. He always thinks that his whole body is filled with germs, his whole body is filled with dirt, so he tries to wash his body, he tries to wash his hands all the time. And sexual is, he has some sort of perversive thought of sex. He thought that he's doing sex with his personal. He starts thinking he is doing sex with uh, his relatives, which is forbidden, unwanted. They has intense unwanted forbidden thoughts, image or urges. Aggression or harm related obsession, like uh, he when he sees the knife, he thinks that he would like to chop his brother, which is not permissible, which is forbidden, but he cannot ignore this thought. Religious is, he becomes he has some sort of blasphemous thoughts concerned about right or wrong and mortality. And the unique one is hoarding disorder. Is a In DSM-5 there is also known as hoarding disorder. It's a new disorder in DSM-5 that is distinct from obsessive compulsive disorder. It is thoughts about acquiring possessions and having difficulty of discarding them. Like, think that you have email from 15 years ago email. We actually, what we do, we actually discard things which is unnecessary. Like, we do not keep our um, book, uh, we do not keep our book which we have studied 15 or 20 years ago, because this is not necessary, and it is in day by day it is renewable, so we do not need those things. But I have, but this type of patient, this type of OCD patient has intense thought of keeping those things and thinking that this might be needed in the long run. And this type of disorder is hoarding disorder. And the final obsession is symmetry. Symmetry is concerned about things that is not properly arranged, perfect or exact, like he is keeping every books in a perfect manner. And if it is not in that way, like if the pen is not there, if the book is not there, he starts feeling some sort of obsession, he starts feeling some sort of compulsion, and that is a obsessive compulsive disorder. This is the common obsessions. And the other is body dysmorphic disorder. In body dysmorphic disorder, there is a preoccupation with minor or imagined defects in appearance, causes significant emotional distress, repetitive appearance, repetitive appearance related behaviors, and mirror checking, excessive grooming, common in eating disorder. Body dysmorphic disorder common in eating disorder. But this is some sort of obsession. And treatment is CBT, cognitive behavioral therapy. And trichotillomania, in trichotillomania, compulsive pulling of one's hair causes significant distress and persists despite attempts to stop. And presence with area of thinning hair, baldness on any area of the body, most commonly the skull. Remaining hair shafts are remaining hair shafts are different lengths versus alopecia. Incidence highest in childhood but spans all age. Treatment is CBD and SSRI. Then adjustment disorder. In what happens in adjustment disorder? Adjustment, this is adjustment disorder. Mood and behavioral symptom onset within 3 months of an identifiable stress. So this line is very high. Mood and behavioral symptoms onset within the 3 month of an identifiable stressor. Marked distress, and or functional impairment does not meet the criteria of another DSM disorder. It does not meet the criteria of another DSM disorder, and there is marked distress and functional impairment and mood and behavioral symptoms onset within the 3 months of an identifiable stressor. What are the differential? Maybe normal stress response, acute stress disorder, MDDs, PTSD, MDDs, so no PTSD. And management is psychotherapy is the treatment of choice. Psychotherapy is the treatment of choice. Adjunctive pharmacotherapy, short term, reserved for relief of impairing symptoms, sleep aid and anxiolytic, sleep aid and anxiolytic. If symptom persists more than 6 months, then MDD or GAT can be considered. uh, it should be start with an identifiable stressor within 3 months and persist less than 6 months once the stressor has ended. This is adjustment disorder. Starts within 3 months, lasting less than 6 months. If it is more than 6 months, MDD or GAD should be considered. Psychotherapy CBT is the first line. Antidepressant, anti-anxiolytic can be given. And the PTSD is very hard. It is very hard, like hyperarousal avoidance, re-experiencing the events, hyperarousal avoidance, re-experiencing the events, and the distress, hyperarousal avoidance, re-experiencing the event, and the distress. PTSD is hard. Experiencing, witnessing, or discovering that the loved one has experienced a life-threatening situation, serious injury, sexual assault, persistent hyperarousal, evidence of social stimuli, intense re-experiencing of the event, and distress, hyperarousal, evidence of associated stimuli, intrusive re-experiencing of the event, and distress. PTSD is hard. Disturbance lasts more than 1 month with significant distress and impaired functioning. Treatment CBT, SSRI, venlafaxine are the first line. Prazosin should be used in nightmare. This word is higher. Prazosin should be used in nightmares. In acute stress disorder should last more than 3 days. Last between 3 days to 1 month. Last between 3 days to 1 month. CBT and pharmacotherapy. 3 days to 1 month. Adjustment is more than within 3 months of the an identifiable stress, so lasting less than 6 months. And the PTSD disturbance lasts more than 1 month within significant distress, impairment, functioning, hyperarousal, PTSD. Duration more than 1 month. This is high. That exposure of life-threatening trauma, hyperarousal, there is hard hyperarousal, persistent hyperarousal, evidence of associated stimuli, intrusive re-experiencing event like nightmare, intrusive re-experiencing event, and distress, changes in cognition or mood, emotional detachment, negative mood, decrease in interest, sleep disturbance, hypervigilance, irritability, duration more than 1 month, than 1 month. This is all about the PTSD, hyperarousal, avoidance of associated stimuli, intrusive re-experiencing thoughts, and distress, intrusive re-experiencing thought and distress. So that's all about the neurocognitive disorder. Hope you enjoyed.